Okay, I want to turn attention on the program now to a controversial bill in California, which, if made law, would force universities in the state to provide students seeking to terminate a pregnancy with abortion pills. The proposal has sparked outrage.
By ensuring that abortion care is available on campus, college students will not have to choose between delaying important medical care or having to travel long distances or miss classes or work.
Not on my dime, not on my dime. Tax me to help the homeless, tax me to help social services, but don't tax me to pay for the disposal of human life.
They should be ashamed to risk women's lives at schools.
Well, let's go through it. If it gets the approval of California's governor in 2023, campus health services at dozens of universities in the state will be required to provide students with abortion pills. According to the bill, there are more than 400,000 eligible female students at California's state university campuses. Now, private donations of about $10 million will be used to train staff, buy ultrasound machines too. But it is feared that eventually the state would have to cover the cost, or indeed universities would have to raise student health fees. Well, a study of adolescent health found that more than 500 women at public universities in California seek medication for an abortion every month. Karen Turk, radio and TV host, and Reese, attorney and author, pick up the debate now.
We have to allow women to decide if they want to pursue their education without the complications of bearing children that would be an economic harm to them. They have to be able to make a choice, and providing them the tools with the abortion pill is simply just doing just that.
We have to give women a choice, but we should also be pushing adoption as an option. Why do we just want to hand them a pill and say, it's okay, here, take care of your problems? You know what? The problem is we need to address this before these women get pregnant. We need to educate these college students. Handing them over a pill is not the answer here.
Are we going to say to a woman, you know what, you had a chance to get an education, to create a better life for yourself, but you've completely ruined that, and now that you're pregnant, you're not going to be able to complete your studies, or there's a risk that you won't be able to do that,
Reese,
and so you just have to drop out and be a person who doesn't have an education, doesn't have the ability to go after high-level jobs, and now you're at a, because when most women are not interested in being on government assistance in order to stay in school.
Most women are strong enough to be able to have a baby and finish
family
school.
Support. You know, we can allow these women to go through with a full-term pregnancy and allow them to choose adoption, but can we actually be honest and discuss the impact of carrying a child for 9 months on a college campus when you absolutely had no desire to be pregnant?
Not only was I an 18-year-old mother, and did I finish my career, and am I here talking to you today, but I'm also the product of adoption. And adoption is an option, and it's an option that seems to be totally off the table in America today. When did we stop talking about the fact that you can give a baby a better life?
It's off the
for
table.
Every baby that is born in America, every baby is born. There are 37 families that want to adopt that baby. Something is very wrong when we're handing out abortion pills on campus.
We're allowing women to decide for themselves based on what they know about their life experiences and their socioeconomic status. Are they in a position to move forward and currently take on the role of being a mother? That is something that's not taken lightly by these women. And I believe that when we allow them the tools to make the choice, they're going to say, you know, I have to make this choice for me.
Very simply, morally wrong. It's morally wrong to promote abortion in a way that it becomes the chosen choice, where it becomes the #1 choice over life. I'm pro-choice. I believe in a woman's right to choose. I believe there are circumstances where she should have that choice. But I also believe that we need to advocate for life.
The reality is that going to school full-time and having a newborn baby is very difficult, and it's a burden that some women have decided that they don't want to take on. And frankly, who are we to say that they should be forced to go to term with a pregnancy if they're feeling that they're not ready?